When a doctor mentions grade 4 cancer, it can sound overwhelming, but understanding what this term truly means is the first step toward clarity and empowerment. The grade of a cancer isn't about how far it has spread, but rather how the cancer cells themselves look and behave under a microscope. It's a measure of their aggressiveness, a window into their biological personality. Pathologists, the doctors who specialize in diagnosing diseases by examining tissues, are the ones who assign this grade. They meticulously study a small sample of the tumor, called a biopsy, to understand its characteristics. They look for clues that tell a story about the cancer's potential. Grade 4 cancer is the most aggressive grade doctors assign under a microscope. In a healthy body, cells are like disciplined workers. They have specific shapes, sizes, and jobs. They follow a strict set of rules, growing and dividing only when needed, and they know when to stop. But grade 4 cancer cells have broken all the rules. It means the cancer cells look very abnormal, a state doctors call undifferentiated, or anaplastic. They've lost the features of the healthy cells they came from. Their nuclei, the cell's command center, are often large, dark, and misshapen, a sign that their genetic blueprint has become scrambled and unstable. Because of this genetic chaos, these cells divide fast, much faster than their healthy counterparts. They are in a constant, uncontrolled state of replication, creating more and more abnormal cells. This rapid proliferation is what allows the tumor to grow so quickly, and they don't respect boundaries. Healthy tissues are neatly organized, but grade 4 cells are invasive. They push into and invade nearby tissue, disrupting its structure and function. This aggressive behavior is a hallmark of a high-grade tumor. It's crucial to understand this distinction. Grade is about how wild the cells behave, while stage is about how far the cancer has spread throughout the body. Think of grade as the car's engine, how powerful and aggressive it is. Stage is the journey, how far that car has traveled from its starting point. This means you can have a high grade at an early stage, a small localized tumor that is very aggressive but hasn't spread yet. Or conversely, a low-grade tumor that has been growing slowly for a long time and has spread to a later stage. Both grade and stage are vital pieces of the puzzle that guide a patient's treatment plan. In the brain, grade 4 often refers to tumors like glioblastoma, the most common and aggressive primary brain cancer in adults. The brain is the body's intricate control center, a delicate organ protected by the skull. When a grade 4 tumor grows here, its impact is profound. These cells grow rapidly, forming a mass that doesn't just push healthy brain tissue aside, it infiltrates it. Glioblastomas are known for their microscopic, finger-like tentacles that extend into the brain, making them incredibly difficult to remove completely with surgery. To fuel their relentless growth, these tumors are masters of supply chain management. They send out chemical signals that trick the body into building new blood vessels to feed them, a process called angiogenesis. These new vessels are often leaky and disorganized, but they provide the oxygen and nutrients the tumor craves. But sometimes the tumor grows so fast that it can't keep up. Parts of it can outpace their own supply, causing areas of cells to die off. This creates dead zones within the tumor called necrosis, a key feature pathologists look for when identifying a grade 4 glioblastoma. The effects of this growing mass inside a fixed space like the skull are significant. The tumor itself, and the swelling it causes, known as edema, increase what's called intracranial pressure. This pressure is the source of many symptoms. It can lead to headaches that worsen over time, often becoming more severe in the morning. This increased pressure can also irritate the brain's centers for nausea, leading to morning nausea or vomiting that isn't related to an upset stomach. The tumor can also disrupt the brain's normal electrical activity, acting like a short circuit and causing seizures. For some people, a seizure is the very first sign that something is wrong. Depending on its location, the tumor can interfere with specific functions. If it's near the motor cortex, it can cause weakness or numbness on one side of the body. If it affects the language centers, it can lead to vision or speech problems, like difficulty finding the right words. A tumor in the occipital lobe at the back of the brain can cause blurred vision or blind spots, and when a tumor grows in areas like the frontal or temporal lobes, which govern our personality, emotions, and memory, The changes can be subtle at first, but profound. This can manifest as personality or memory changes, because the tumor disrupts the delicate circuits it presses on or invades. Swelling around the tumor raises pressure in the skull, which can intensify symptoms. This is why managing this swelling is a critical part of treatment, often using medications like steroids to provide relief and protect brain function. In the rest of the body, grade 4 cancers are also defined by their aggressive nature. They are prone to spread or metastasize, hijacking the body's natural highways, the blood vessels and lymphatic system, to travel to distant sites and establish new colonies. This systemic spread is what leads to widespread effects. One of the most common and debilitating symptoms is a profound, persistent exhaustion that isn't relieved by rest. They can cause deep fatigue because the cancer consumes a huge amount of the body's energy and releases inflammatory substances called cytokines that make you feel constantly tired and unwell. This high energy demand can also lead to unintentional weight and muscle loss, a condition called cachexia. This isn't just simple weight loss from a poor appetite. It's a complex metabolic syndrome where the cancer actively reprograms the body to break down its own muscle and fat tissue, leading to severe weakness. Pain is another common issue, which can occur if a tumor presses on nerves, bones, or other organs. Managing pain effectively is a cornerstone of compassionate cancer care. Aggressive cancers can also make the blood more prone to clotting by releasing procoagulant factors. This increases the risk of developing dangerous blood clots, often in the legs or lungs. Some cancers, particularly if they spread to the bones, can cause bone to break down and release its calcium into the bloodstream. This can lead to high calcium levels, a condition called hypercalcemia, which can cause confusion, dehydration, and kidney problems. Ultimately, if tumors grow large enough, they can cause organ failure if they block or infiltrate vital structures, like the airways in the lungs, the bile ducts in the liver, or the vessels that supply blood to essential organs. In a fascinating but challenging twist, some cancers trigger immune misfires called perneoplastic syndromes. Here the immune system, in its attempt to fight the cancer, creates antibodies that cross-react and mistakenly attack healthy tissues, often affecting the nerves. Other tumors can act like rogue factories, producing massive amounts of hormones that throw the body's delicate chemical balance into disarray. Facing a grade 4 diagnosis requires a powerful, multifaceted approach. Treatment depends on the cancer type, its location, its genetic makeup, and your overall health. There is no one-size-fits-all answer. Care is deeply personalized. Options often begin with surgery to remove as much tumor as safely possible. The goal is maximal safe resection to take out the cancer while preserving the function of the surrounding healthy tissue. After surgery, or if surgery isn't possible, doctors often use radiation to target remaining cells. High-energy beams are precisely aimed at the tumor area to damage the cancer cell's DNA, stopping them from dividing and causing them to die. And chemotherapy, which uses powerful drugs that travel throughout the body to kill fast-growing cells, remains a cornerstone of treatment for many grade 4 cancers. But modern oncology is increasingly moving towards smarter, more precise treatments. Targeted therapies go after specific mutations or vulnerabilities present in the cancer cells but not in healthy cells. These drugs act like guided missiles, honing in on what makes the cancer tick and shutting it down with fewer side effects. Immunotherapies represent a revolution in cancer care. They don't attack the cancer directly. Instead, they help the immune system recognize and destroy it. Checkpoint inhibitors, for example, release the brakes on immune cells, unleashing them to fight the cancer they previously couldn't see. And in select cancers, CAR T-cell therapy offers a living drug. A patient's own immune cells are collected, genetically engineered in a lab to hunt for a specific target on cancer cells, and then returned to the body as an army of supercharged cancer fighters. For glioblastoma, doctors also use an innovative approach called tumor-treating fields. This is a wearable, non-invasive device that delivers low-intensity electric fields through arrays placed on the scalp. These fields disrupt the ability of the rapidly dividing cancer cells to multiply. Alongside these treatments, supportive care is essential. For brain tumors, this includes steroids to reduce swelling and relieve pressure. It also includes anti-seizure meds to prevent or control seizures, dramatically improving a person's quality of life and safety. The field is moving at an incredible pace, and clinical trials can offer promising approaches that may become the standard of care tomorrow. Participating in a trial can give access to cutting-edge therapies while contributing to the science that will help future patients. And critically, palliative care is not just for the end of life, it is a specialized layer of support that can begin at diagnosis. The palliative care team works to manage symptoms like pain and fatigue and supports the emotional and spiritual well-being of both the patient and their family, ensuring the best possible quality of life alongside treatment. The key is a personalized plan from a multidisciplinary team. This isn't the job of one doctor, but a coordinated effort by surgeons, oncologists, radiologists, nurses, and many other specialists, all working together for you. A grade 4 diagnosis is serious, but it is met with serious science, relentless innovation, and deep compassion. The path forward is built on a foundation of knowledge, teamwork, and honest conversations about goals, benefits, and side effects, ensuring that your care aligns with your values every step of the way.